My name is Zachary Kellman. Imagine sitting with your mom or loved one in the waiting room at your local doctor's office. The sound of multiple heartbeat monitors, the scent of uneasiness fills the room. You see the doctor's door swing open. The results are in. My job today is to inform and raise awareness to my audience about breast cancer. I will first explain what exactly breast cancer is, the symptoms you should be aware of, and the most effective treatments offered after diagnosis. Let me start off by explaining what breast cancer really is. As best explained by the American Cancer Society website, it is a group of cancer cells within the breast that can grow or spread into different tissues of the body. Lymph nodes are the filters along the lymphatic system. Their job is to filter out and trap bacteria, viruses, cancer cells, and any other substances that shouldn't be there, and safely eliminates it from the body. According to the Mayo Clinic of Minnesota, breast cancer is the second most common diagnosed cancer in young women today. Though this is valuable information, knowing is only half the battle in this spreading epidemic. The following information is a detailed list of symptoms that can help you detect the problem before it is too late. All information is based on the findings in Career Cancer Facts and Figures of 2013 and 14. When breast cancer starts out, there is usually no signs or symptoms because it is very, very small and it is at its curable stage. Go figure. That is why the people who produced the Breast Cancer Facts and Figures for 2013 and 14, they recommend having young women follow specific guidelines for screenings, so if there's any problems, they can catch it at the early stage. Also mentioned in the Breast Cancer Facts and Figures for 2013 and 14, even before the original breast cancer lump is large enough to be felt, it can already have spread throughout the underarm lymph nodes and cause lumps or uncomfortable swellings. More signs consist of breast pain or an increase in heaviness, persistent changes in the breast, or nipple abnormalities such as discharge, erosion, or tenderness. Any persistent abnormalities in the breast should be evaluated and monitored by your physician. When diagnosed, it seems like everything in life starts to change. Well, most women diagnosed commonly undergo surgery. There is a wide variety of options when it comes to the surgery, depending on each and every individual's case, such as removal of the cancer itself, removal of the limited number of lymph nodes, or possibly removal of the whole breast. Even before or after surgery, you could still go through with chemotherapy and hormone therapy. Radiation therapy is the use of a high concentration energy beam that kills the cancer. It is most likely to be used after surgery as well to destroy the remaining cancer cells that are left afterwards. Stated by the Breast Cancer Facts and Figures for 2013 and 14, systemic therapy is a treatment that travels through the bloodstream and affects all parts of the body, not just the cancer. These cancer drugs are injected into the vein or given by mouth. Systemic therapy includes chemotherapy, hormone therapy, and targeted therapy, all of which work through different mechanisms. In conclusion, I have effectively stated what exactly breast cancer is, the different signs and symptoms that you can be aware of upon diagnosis, and I've described different treatments patients can undergo. Whether the results you receive were positive or negative in the waiting room, it is important to keep your head up high and to be aware of the cancer. The ride is far from being over, and if you have a loved one going through this, you just make sure you're always there for them. You make it through everything just fine. Thank you.